The news that a world-first designation of a gender-free baby in Canada will come as no surprise, but should come with a great deal of alarm. Canadian officials have issued an ID card with a U instead of an M or an F, standing for unassigned. Other government authorities are yet to come to the party, however, and they haven't yet issued a birth certificate for Cyril Alty, the mother of a woman who is also transgender. Now, many patients I see speak of being stuck in the wrong body. Young men taking steroids, assuring me their Herculean bodies are merely a sign of their journey to their authentic selves. Others who speak of having found their essence after I've given them antidepressants. Much like the gender-confused patients, their true selves are the ones made by medical science. Now, in my profession, the gender-confused used to be called gender identity disorder, but since been changed to gender dysphoria because it's essentially less stigmatized. The transgender activists want you to think that they're not mentally ill, but at the same time, they want access to the health subsidies. Now, colleagues who've helped transition transgender patients to the opposite sex say they're just helping relieve the distress, much like any other patients. The same colleagues are also sympathetic to the activist view who want sex change to be much like having a baby, a normal life procedure that requires some medical input. Now, the strongest critics, such as my colleague, Professor of Psychiatry Paul McHugh of Johns Hopkins, they have not changed their tune despite the cultural tide. He's one of the world's top experts in the field and pioneered treatments in the 70s and 80s. His views, strongly endorsed by the American College of Pediatrics, are that gender reassignment surgery and the giving of cross-sex hormones are essentially a type of child abuse. Despite the subjective sense of relief many patients report, the much higher than normal suicide rates, up to 20 times higher for gender changes, remains. So despite the air of knowing science that medical profession likes to communicate, it's not immune to the forces of culture or activism. Alternative medicine is a good example, a force that came from outside science as part of movements to embrace, say, a natural authenticity. But despite the lack of any scientific foundation, many doctors have embraced the practice. In Australia, I'd argue many of the fly-in, fly-out doctors who called our asylum seeker detention centres gulags of torture were also activists first and foremost, and did so with the Trojan horse of science to advance their political agendas. Likewise, lots of psychiatric diagnosis is really from cultural trends. Fugue states in 19th century France, false memories in the 90s, even post-traumatic stress came out of the politics of the Vietnam War. My Aussie colleague in Queensland, Dr. Stathis, has witnessed a dramatic rise in presentations in his gender dysphoria clinic and sees its rise very much as a cultural fad, noting many teens adopt a try-out strategy as a way of being different. Over 90% will grow out of it, usually becoming ordinary, usually gay adults. But there's a growing push to present the perfectly reasonable wait-and-see approach as reparative therapy, likening it to conversion therapy for homosexuals. The pioneering centre in Toronto, which has researched gender confusion for decades, led by world expert Dr. Kenneth Zucker, was shut down last year by lobbyist pressure for allegedly encouraging reparative therapy. This was a dramatic victory for the transgender movement, one that may encourage an international hubris. While activists and colleagues working in the space, often past sufferers of gender and sexuality confusion themselves, argue that our cultural conditions are working to reveal transsexuals, I'd argue that they're actually creating them. More people have started to conceptualize and interpret their experience in these terms, making sense of their lives in a way that wasn't available to them before. This would be harmless if there weren't forces determined to intervene on their behalf with life-altering medicine, their moral fervour fueled by an image of themselves as the latest soldiers of civil rights. If allowed to continue, the rise of the transgender movement may represent one of the great victories of identity politics. That subjective truth and personal testimony is paramount, secondary to even biology. If you like this video, subscribe to Rebel Media for more.